I'm excited to bring up, our next speaker, who is also a doctor right out of North Canton, Ohio, and that is Dr. Latrice is in the building. So thank you so much for being here, Dr. Latrice. If you don't mind, tell the people a little bit about who you are and what you do.
All right. Thanks for having me, first of all. So, I'm a published author, a speaker, a transformational coach, a healthcare executive, but most importantly, I am my mission. And my mission is I believe, if you look around the world, you see Black and Brown people dying because of inequitable care. I believe that we can radically change the communities of our Black and Brown individuals. And my passion is helping teams and individuals realize that equity in health and healthcare is attainable. And for me, even though I'm a healthcare executive, this is personal because I've been there.
Absolutely. So there's a lot to dive in there. I do want to find out a little bit more about your journey. Like, how did you get to this place where because healthcare is, without access to it, equitable access, which we're going to talk a lot about, in the next few minutes, things start to fall apart as society. But, I feel like that's a really niche area to get into. So I'm really curious about, what was your journey, the progression to get to this point?
So I grew up in a housing project. My family, we were on public assistance. I had my son young. And so then I was in the system, not being treated appropriately and, not realizing or having the words for how they were looking at me, not listening to my concerns, kind of brushing me off. So fast forward about 15, 20 years, I began working in healthcare and I watched day after day as we delivered transactional care. People, when they leave the doctor's office, they have to go back home to their communities where they're fighting poverty, homelessness, all of these issues that we're not dealing with in the healthcare arena, but we have to marry community with health care delivery in order to truly have impactful transformational change. It is my goal and my life's mission to assist in moving the delivery of healthcare from transactional to transformational, because at the end of the day, it's life or death. We're dying because of inequitable healthcare. So I came up, I grew in this space where I was that marginalized population that just was being pushed through the system. And now with infant mortality and the impacts of COVID, seeing just how our community is crumbling, it's just, this has just become my life's mission. If I didn't have bills and had to pay for lights and housing and food and stuff, I do this work for free.
Yeah, no, I could really sense the passion and the fact that this is a ministry. So many things I want to ask you. I guess, who would you consider your target audience? Because I really feel like the question or the concept around creating equitable access to healthcare isn't something that one organization could solve by itself. It seems that you have to bring multiple partners to the table, including, as you mentioned, community. So the everyday people, to healthcare providers, pharmaceutical companies, to governments. And so from your perspective, who do you like how who do you decide who to talk to? Like, who are the people that you are trying to bring to the table in order to have this conversation and actually to start to create policy and transformation to achieve, this goal?
Right. So for the downstream work, which is the individuals that are receiving the care. So my audience is the consumer, the individuals, the Black and Brown community, because we have to have skin in the game. We have to be equipped and ready with the appropriate questions and actions when we go in and receive this health care. And then also anyone that is considered a gatekeeper. And for me, gatekeepers are anyone that has a say in the delivery of services, resources, care, information. So nonprofit organizations, hospitals, community faith leaders, because it truly takes a village to create the type of change that I'm trying to create. So I work with nonprofits, I work with hospitals, and I work with individual community members, because it's going to take all of us.
Yeah. Wow. Yeah, that makes a lot of sense. I know oftentimes it's almost like a balance because on one hand, I'm like, if I'm experiencing a symptom of something, I resist the temptation to, jump onto like WebMD and try to self-diagnose and figure out what's going on. But at the same time, I want to be an educated and informed, I guess, consumer of healthcare in order to, improve my own patient experience. But I do think a lot of times there is we're just kind of out there. Like we don't know what questions to ask. We don't know how to navigate the system. There are layers of complexity, particularly when you add in like insurance and all these other things. And so, the more that we can empower individual patients to, not be afraid to ask questions and to, self-advocate for themselves and our family members, I think the better. So just on a personal note, I'm really, really happy that I don't know anybody else, I think, doing the work that you do in this space. So I'm happy that you are doing that. I do want to ask a question about kind of what is the end goal in your mind. So, like, how will we know that we have actually achieved like this a standard of equitable care that kind of matches up to like the vision that you have in mind?
Right. So some of the work is in the data. So when you think about infant mortality, Black babies are dying 3 to 1, right? So it's right there in the data. You have chronic disease management. When you look at COVID, the percentages for Black and Brown people was far greater than non-minorities. So it's in the data as well. But you know what? A lot of this work is truly qualitative because it's about your lived experience, your perception. So, I really don't know. I really don't have a litmus test for it right now. But when I speak with individuals after I work with them, the difference in how they feel, the level of anxiety, the level of being heard, the empowerment that I give them with arming them with questions to ask. So just when I talk with individuals and there is a difference in how their doctor and their team is showing up for them, when they have those educated, insightful questions that they're asking of their physician. So just in the lived experiences of community, and then looking at data. So looking at the cancer rates, Black women, and the rates that we have cancer, but that we die from it is so much higher. So data is out there that we can truly measure health outcomes to see if we are closing that equity gap between those outcomes of disease states and community members.
Perfectly said. And I know that your organization, actually called Equity House, if I'm not
Mhm.
mistaken, is responsible for actually curating and managing those programs. And so, when you all visit Black Speakers Network, click on directory, make sure, when you look up Dr. Latrice, you can find out more information about the incredible, where it's impossible to synopsize into like 5 minutes, but really, really important work. And so I'll leave you with the last question. I think you kind of touched on a little bit throughout the course, but if there's anything else to add about, just the legacy, that you're looking to leave doing this work, feel free to share.
Yeah, absolutely. The legacy I want to leave is that I was a catalyst for change, changing the implications for people who are caught in the crossfires of inequitable care. So just that catalyst for change, that person who has helped move things into transformation, because right now it is so transactional. So that is the legacy that, I want to leave for myself, that I've been able to cultivate change in the lives of our most vulnerable, our most marginalized populations and communities, to create healthy people living in healthy communities.
Yeah, I think that is super important. And Black Speakers Network, I think we have an important opportunity to use platforms like this to continue to share, educate, and let people know, what the options are, and just to be a channel of hopefully, bringing that vision to life, Dr. Latrice. And so thank you so much again for sharing. Again, if you all want to connect with Dr. Latrice, if you know people that should be connecting with her, if you're a healthcare if you're in anywhere within that ecosystem of people and community that she mentioned, make sure that you either directly connect with her or again share this video so that she can get connected to the folks that can continue to make this thing happen. But Dr. Latrice, thank you so much. And of course, thank you for being a part of the Black Speakers Network community.
Brian, thank you.
Yeah.